Hi there, physio students. Welcome to the cardiovascular presentation part 1. So I've given you half the packet, and we're going to study the heart this week, and then next week we'll focus more on the blood vessels and blood pressure. So make sure you have your packet ready to go. This presentation is designed to help you fill out your packet as we discuss the cardiovascular system. Luckily, you already learned about a lot of the anatomy of the heart when we were dissecting the cat, and you had the opportunity to actually see the diaphragm and how the lungs and heart reside up on top of it and cut through the pericardial sac and find the heart inside there. This is kind of a nice diagram that shows a transverse section looking from a superior view, so you can see that your heart fills up almost the space between your vertebrae and your sternum. And that enables you to do CPR on someone when their heart is failing. If you press on their sternum, you can actually squish their heart in between their spine and their vertebrae and continue to squeeze it to pump blood through it. So we're going to be focusing more on the physiology of the heart than the anatomy of the heart this week, because you've already kind of learned about it. But in order to talk about the anatomy of the heart, you need to be familiar with some of the terms. So artery, vein, atria, ventricle, right and left are the things that I want you to focus on using this diagram right here. I've mentioned this before, but when you're looking at a diagram, the right side of the diagram is on the left side of your paper, because it's like you're looking at someone else's heart and they're standing in front of you. So just as if you were going to not shake hands with them anymore, but maybe bump elbows, you'd have to reach across to your left side to touch their right elbow. So make sure you notice that the right side of the heart and diagrams is on the left side of your paper. The vessels that carry blood into the heart always deliver it into these top two chambers, which are called the atria. And those vessels are called veins. So veins always carry blood toward the heart. Most of the time, the veins that you're looking at in your body are going to be carrying this blue or deoxygenated blood, but that's not always true. On the left side of your heart, these veins are coming back from your lungs, and so they're full of oxygen and they're red, but they're going towards your heart, so they're called veins. Arteries, on the other hand, are always carrying blood away from your heart. And so most of the time, because most of the places in your body is coming from your left side of your heart, they're full of oxygenated red blood. So arteries are often red, but not always, but they are always carrying blood away from the heart. Blood doesn't flow straight through your heart like this, but we're going to look in some subsequent slides at how these arteries that go out of your heart are actually coming up through the center and blasting out on the top of it. This diagram has the actual location of the two atria. This is is it right or left? Yes, it's the right atria, and this is the left atria. Those are the two top chambers. This is the bottom chamber. What's it called? You're right. It's called the left ventricle, and over here is the right ventricle. This diagram, you can see that the right muscles of the right ventricle are much thinner than the walls of the left ventricle, and that's because it has such a smaller job of just pushing the blood to the right lungs that are right next to it, whereas the left side has the job of pushing the blood everywhere else in your body, from the top of your head to the tips of your toes out to your fingers. This diagram's also doing a good job showing you the valves in the heart. So in order to keep blood flowing in one direction, the valves are designed to prevent it from going the wrong direction. So when your atria are filling up with blood, these valves will be closed so they can fill up. And then once they start to squeeze, the pressure inside these chambers will push the valve open and allow the blood to flow into the next chamber. When your ventricles begin to squeeze, they start to develop pressure inside of them, and that pressure will slam these valves shut. And then when the pressure in the ventricles is greater than the pressure in the arteries that's leaving them, then these valves will open. So these valves have different names. Collectively, the ones between the atria and the ventricles are just called AV valves, or atrioventricular valves. And then these are called semilunar valves, and they're named for the arteries that are leaving them. So the specific names for the valves are based upon how they look, how many cusps they have. On the left side of your heart, there are just two cusps or parts that make it up. I remember that the left side is the bicuspid valve because it has two cusps, but it also often gets called by this other name, the mitral valve, maybe because this is the one that blows out and has problems happening in it most often. The letter L and M are really close in the alphabet, and that's how I remember the name of the left valve. On the right side, this valve has three parts to it, so it's called a tricuspid valve. And I know that the letter T and R are really close together, but also tricuspid has an R in it. So that's how I remember the names of those particular valves. Here's a view of the valves from up above, and you can see the three cusps of the tricuspid valve and the two cusps of the mitral valve. When the ventricles contract and there's a huge amount of pressure, these extra little strings help, called the chordae tendineae, help the valves not blow inside out. But sometimes the pressure is so great that especially this mitral valve will get a leak and it won't be able to close all the way, and some blood will squirt into the back up into the atria when the ventricle is contracting, and a little bit of blood will leak through. That makes a little sound called a heart murmur. And if you have that, sometimes you have to take extra precautions, like if you're going to have a dental surgery and there's a possibility that bacteria could get into your bloodstream, you might have to take antibiotics before you have your dental surgery, because that the blood can pool behind the valve where it's leaky, and that can be a place that bacteria can reside and cause you to have a heart infection. The semilunar valves are just named for the arteries that they're going to. So this one right here is called the pulmonary valve because this artery is going to take the blood to the lungs, which is your pulmonary system. And then this valve, you can barely see it on this side. It's called the aortic valve because it's connected. It's separating the ventricle from the aorta, this great big fat bright red blood vessel. These are the answers on page 177. I think we already did those. In your packet on page 178, you have a diagram you're supposed to label and color in, and you may have already done that when we were studying the cat, but if you didn't, you can do it right now. The diagram you start with a drop of blood that's in the right atrium going through the tricuspid valve. It goes into which part is this? Right ventricle. And then it goes through this valve. What is this valve called? It's going out to the pulmonary artery. So this is the pulmonary valve. Branches off to the right and left lung through the pulmonary arteries. And then the vessels branch smaller and smaller into smaller arteries. Eventually they're little arterioles. And eventually they're so small they're only as wide as one red blood cell. And diffusion occurs. So at this point, when there are capillary beds is when diffusion of oxygen and carbon dioxide and nutrients is happening, and then the blood is going to change color because now it's letting go of its CO2 and picking up its oxygen. Those little capillaries will start to converge into little tiny venules, and then they'll converge into bigger veins, and eventually the blood will come back to the heart. There's going to be two little pulmonary veins dumping into this side of what's the name of this chamber? Left atrium, and two little pulmonary veins dumping blood in from the other lung, from the right lung. So there are four little vessels coming in there. From the left atrium, blood goes through, what's the name of this valve? The mitral or bicuspid valve, into the left ventricle. And then from the left ventricle, when it squeezes, it's going to leave through this valve to the aorta. What's the name of that valve? Called the aortic valve. And then blood will squirt everywhere else in your body, going to smaller and smaller and smaller arteries, goes to capillary beds around all of your organs. Diffusion occurs. Your cells take out the oxygen, put in their CO2, and then it'll come on back to the right atrium. So there's two major veins that deliver the deoxygenated blood back into the right atrium. The one that comes from above is called the superior vena cava, and the one that comes from below is called the inferior vena cava. So you should be able to check your answers on this to page 178. You can do that later. Surface anatomy of the heart. This diagram, the packet has all these like blanks at the bottom of the page, but I think it's easier to just identify all the parts by labeling it right on the diagram. So in this real heart, looking at the surface anatomy, it's kind of harder to see the right and left atrium. On an actual heart, they're kind of paler looking because they're not as thick of muscle as the ventricles are. 3 and 4 are pointing to the right and left ventricle. 5 and 6 are pointing to the superior and inferior vena cava. 7 and 8 are pointing to the arteries that are leaving your ventricles. This big curved one is the aorta. That one would be bright red. And the pulmonary artery is actually called the pulmonary trunk right at the bottom because then it immediately branches off like a big tree into the right pulmonary artery and the left pulmonary artery to go to your right and left lungs. Blood then returns from your lungs through the right and left pulmonary veins. So these veins are going behind all these blood vessels and dumping into the left atrium, and these are just dumping right into the left atrium. What else is labeled on this? Oh, you have coronary vessels that branch off right away from your aorta. These blood vessels supply your heart itself with its food and oxygen. Since your heart is contracting 50 to 70 times per minute, even when you're just sitting around resting, it uses a lot of food and oxygen. And a lot of times you'll notice there's all this fat kind of layered around them. I don't know why your heart is that way, but it has a lot of fat around it. And I think these blood vessels often get clogged with a lot of cholesterol, which is sort of related to fat. If the coronary vessels become blocked with plaque that's building up, then blood can no longer flow through it, and the cardiac muscle that's below that blockage will die. That's called a myocardial infarction or a heart attack. Treatments to fix that include a variety of things. Sometimes people will get a little wire with a little inflatable balloon on it, and they'll try to inflate and stretch the artery and try to clean out this plaque. Sometimes people will take medications that can dissolve this plaque. Sometimes it's so badly blocked that doctors will actually get an artery from inside the chest wall cavity and attach it to your heart to try to nourish the area if it's not completely dead yet. So those are some of the quick surgeries that would happen for someone who's having a heart attack. The other parts that are labeled on your heart on this diagram are the apex, which is the pointy end of it that's down at the bottom. And then they pointed out this little spot called the ligamentum arteriosum. Before you're born, you don't use your lungs when you're still in your mom's body, inside of all her amniotic fluid. You practice using your muscles, but you're just sucking in amniotic fluid and not getting oxygen out of it. You're getting all your oxygen from your mom's blood, and it's coming through your umbilical cord. So there's actually a little hole between these two arteries, and there's a little hole called the foramen ovale between your two atria. When you're born and you take your first breaths, that little hole between your atrium slams shut, and this little flap turns into this little ligament that holds these two blood vessels together. Sometimes that doesn't close all the way, and so your red blood and your blue blood mix a little bit instead of getting effectively pumped to your lungs. Some of that deoxygenated blood ends up going out to your whole system. Babies that are born with that happening are sometimes called blue babies because they're not as pink as a baby that's getting all of its full oxygenated blood. So that first little holler that you do when you're born, that clears all the amniotic fluid out of your lungs until you start delivering your own oxygen to your own blood. You're supposed to turn really pink right when you make that scream, and if you don't, then maybe you have a little hole in your heart. It usually heals itself up on its own. So you're going to be learning a little bit about your heart valves. This is showing that when they're open, blood is flowing through them. And you're going to do a POGL about the pressure gradients that cause this to happen. So I'm not going to talk too long about it. This is showing the ventricles squeezing. And when they're increasing the pressure, then the valves close to prevent blood from going backwards. This is showing when the ventricles are squeezing hard enough, then blood will eject out of the ventricles and into the arteries. and that's showing the semilunar valve open. But once they start to relax again, when they're not squeezing, then the pressure gets lower behind them, and then the semilunar valves slam shut and prevent blood from going backwards. So those slamming shuts of the valves is what makes your heart sounds. And the word for your, I'm going to go back again. The word for a part that is squeezing, when this is squeezing, it's called atrial systole. When your ventricles are squeezing, it's called ventricular systole. And then when they're relaxing, when they're not squeezing, the muscles aren't contracting, it's referred to as diastole. So the words systole and diastole are going to be used a lot when we talk about blood pressure. And the blood pressure is the pressure that's occurring when your arteries are full of blood right after the ventricles squeezed it out, squeezed all the blood into your arteries. They kind of stretch open a little bit. And then when your ventricles are relaxed during diastole, then the blood is just getting pushed along by the elastic recoil of these blood vessels that got squeezed out. So you can feel that little stretching and relaxing of your blood vessels when you're taking your pulse, which I hope you're doing every day. So I'm going to stop right here. Before you go on, go to page 181. You have a diagram that's kind of like this. And use that diagram to practice labeling the right and left atria, the right and left ventricles, the chordae tendineae, you could even label the different valves that are in this diagram. And then I think you should do the POGL next, the cardiac cycle POGL. And after you've done that, then you should continue and do the rest of this, the next presentation.